So we'll just demonstrate how to help somebody out of bed using the hoist. Before we get started, we need to make sure that the bed's safe. So if, Carly, could you put the brakes on, please? And we'll raise the bed to the right height for the carers. The ideal height would be that the bed's at about waist, hip to waist level, saves us bending over too much while we're helping roll the person. So about there. Now to start off with, Runga, we'd ask you to roll towards me. So to do that, could you bend up your knee here, please? Bring this arm across your body, look towards me, and bring yourself over this way. And we tuck the sling in underneath. Half of the sling tucked in with the seam at the bottom here, about at Lunga's tailbone, and the middle of the sling running up his backbone. So in that position there. Then we get you to roll back again. And roll to your other side. That's it. We scoop the sling out underneath you. And come back onto your back. And we see that we've got you in the middle. You can tell that we have. Then we take the leg loops, pass one under each leg, making sure that the fabric here is not bunched up or creased. It'd be uncomfortable for someone to sit on. That's all set to go. We can bring the hoist in now. We need to make sure that the hoist is raised far enough so that we're not going to hit the person with the boom as we bring it over the top of them. And also, sometimes it's necessary to adjust the legs of the hoist to make sure we can get it adequately underneath the bed. There we go. So turn the boom round. And then lower it down towards the tags. There are various different types of attachment systems for slings to hoists, and this particular one uses a keyhole shaped tag that attaches onto the lug of the hoist boom. Right, now the instructions for the patient are, Runga, if you could fold your arms across your chest like that and bring your chin into your chest. As we raise up the hoist, you'll start to lift up off the bed. We'll do that now. Just as we start to take some of Runga's weight, we make sure that the attachment points are positively clipped onto the boom of the hoist to stop one of them from falling off. All right, we're ready to go. Runga, chin to your chest, raising you up off the bed. We'll bring you up into a sitting position as you come up off the bed.
Hello.
And your bottom free, yep. All right, now we're ready to bring you across towards your wheelchair. So, Charlie, help with your legs. I'll bring the hoist back. We turn you around. You can see that if we turn Runga around here, his knees are going to bump into the hoist. So if we lower him down a little bit, we'll get him a little bit more clearance. Yep. Bring him down towards the wheelchair. Brakes on the wheelchair. And now Carly can use the sling to bring Runga back, bring his bottom back into the wheelchair as we lower him down. There we are. And we make sure each of the attachment points is slack. And detach the hoist from the sling. Take that away. Tuck out the leg loops from underneath Runga's legs. And we'd ask you to lean forward, Runga. We can take the sling out from behind you.